what was your first reaction? When did you first realize that meal delivery and the whole process would have to be modified or taken a second look at when the crisis started happening earlier this year?
Well, it started happening in March, but let me just correct your tense. We are not through the crisis yet. It goes on day after day here, really. It's a continuing crisis for Meals on Wheels, certainly. We hope it's going to be over soon, but it's not yet. But back in March, as the number of requests for Meals on Wheels began to climb, many of our regular volunteers kind of retreated. They were retired seniors, many of the former volunteers who were either leaving town or just taking a leave from community contacts. But amazingly, the telephone began to ring and others called just offering to help. These were people who were newly working from home. In some cases, their children were home from school and college, so they worked as families or individually. And mostly the offers came from residents of New Rochelle, but some other nearby communities, people from some other nearby communities called in too, and they still are. Nearly every day we get new offers of help from volunteers by email or by phone. And I would just like to say that both Volunteer New York and Julie Convisser, I hope I'm pronouncing that correctly, of Volunteer New York, she's serving as the New Rochelle City's Director of Community Engagement. And they've both been very helpful steering volunteers our way. So that's when we realized, the volunteers were retreating and the number of clients were dramatically rising. Want me to keep going?
Did people just of their own volition step up, recognizing the need?
People stepped up. It's amazing. The phone rang and rang and rang with, we're working from home, we have time, do you need help? It was amazing. And I'm sure the people like Julie and some of the members of City Council were also putting out the word that, we were going to need extra help. So, but we didn't really have to do a lot of recruiting, to tell you the truth.
Marvelous.
It was. It really was. And then as far as the clients are concerned, very early in March, we had to eliminate all direct contact between volunteers and clients. And there was no more going into homes and individual apartments to deliver the meal and have a chat and, a friendly little visit. Clients were told they had to leave a bag or a box or some kind of a receptacle at their door. And the volunteers were told to leave the meal in that container, ring the bell, and then just back away and wait for someone to answer the door. If someone didn't answer the door, call the Meals on Wheels office, let us know, and just go on their way. And then we handled it from there. So that's how it began to work very early in the whole situation.
Well, we have some of the photographs of the doorways of different clients' homes, and it's so affecting, really, to see that, because what we always see is that the volunteers would be handing off the meal, and we know that, so many volunteers and clients have that close relationship, and then here it became, because of the virus, that was just eliminated.
Exactly. Normally people would go into the apartments or the homes and say, where would you like us to put the meal? And they either put it on the table or on a counter in the kitchen, but no more of that. Obviously we still don't do it. We are still keeping our distance for everybody's safety.
Right.
So Pat, did you get that protocol from Meals on Wheels National, or is that something that just evolved, or is that something that you created? How did you get to the decision to leave the meals out in designated areas outside people's doors, and how did you communicate that to the clients?
Well, I think that you would have to say it evolved just from what was going on and the instructions from I don't know, the CDC everywhere to keep your distance and no contact and so forth and so on. And we picked up the telephone and we just called one day. We called every client. We said, starting tomorrow or the next day, you must do this. And that's the way you're going to get your meal from now on, period. And the volunteers the same. And the volunteers, of course, they couldn't even go into the hospital to pick up the meal without a mask. So early on, they had masks and gloves, which we provided at first, but then, of course, everybody had their own, and it just became second nature to have a mask on, you know.
Right.
And I think it just suddenly had to be that way, you know.
And
There is no, just for clarification, there is no national anything that hands down orders to us, really. We are completely self-contained, but Meals on Wheels America does put out recommendations, certainly, and makes suggestions and gives you ideas, yeah.
That here, unannounced and unwelcome, the virus appeared, and New Rochelle, Meals on Wheels of New Rochelle, and Pat, Lorraine, you marshaled the situation right away and hit the ground running.
Well, I agree. We did. It was really seamless, and there was a note in your proposed questions about how did it get coordinated, and I have to give a lot of credit to the hospital too, because early in March we were notified that there would be no more access to Schaefer, the nursing home, where meals were normally picked up, that the meals would be wheeled from the kitchen into the main lobby of the hospital for pickup. And at first the hospital assigned a staff member to oversee that pickup every day and serve kind of as a liaison with the kitchen. But as everybody got used to the changes and the pickup went smoothly, our own volunteers, 2 of them in particular who are heroes, took over the daily supervision, and they're still there every day ensuring that there's no mishap and no chaos. And so it's amazing. It just it really has gone very smoothly, and we've had very, very few, if any at all, problems. The volunteers have been cooperative. The hospital has been...
Montefiore of New Rochelle.
New Rochelle has been amazing. Really, the seamlessness is due to the generosity and the adaptability and the concern of all at the hospital working with us. And they've adapted, they've increased the number of meals. We added a daily route to our number of routes that we set out around the city, and another one on each day on the weekend. And they accommodated that, and they have been wonderful and very, very concerned and very helpful. So I have put in that plug for Montefiore for sure.
Yes, yes. It sounds like the British byword of World War II, keep calm and carry on.
Exactly.
I got briefly cut off.
Pardon me?
So you were mentioning that you added a route. You added a route.
Say that again. I'm sorry, Carney. It just doesn't all come through. The route?
Yeah, something happened to the connection briefly. Yeah. You added a route, correct?
A daily, yes, one daily route. When we had just about a 60% increase in the number of people we had on the program, and so we added one route to we now have 6 routes throughout the city, and they are larger than they used to be, but by sort of allocating certain days of the week. If it works for people, we ask them to take the meals on a partial week. If it doesn't work, they take the whole week. but giving some people a partial week kind of spreads the resources. It doesn't overwhelm us, and it doesn't overwhelm the hospital kitchen, and it seems to work very well for people. So that's how we've sort of spread things out and added a route on the weekends. We have 3 routes each day on the weekend and 6 during the week. So you can imagine that's it's a bit of a challenge to staff those routes every day.
Wow.
But people have been very generous.
Right. Did you see the demographic of the additional people that were added to the Meals on Wheels and New Rochelle rolls? How did they learn about our services? Was it word of mouth? Are these people somehow linked to each other? Were they routed by an organization? And did they all have similar backgrounds, or is it a diversity of different people that had needs?
Well, as far as I think the big increase is concentrated downtown more than spread out. How they heard about us, probably through doctors, through social workers, and through each other. They see people coming into their apartment buildings and the meals being delivered. And when they could no longer get out, or the doctor advised them not to go out, then they said, call Meals on Wheels. Visiting nurses, it's a whole, and the senior center also referred a number of people to us who were no longer able to come to the senior center for lunch.
Right.
Yeah.
So it was a variety of sources, but the bulk of the people, I would say, are concentrated in the downtown area.
Understood.
And the senior buildings, and spread out among all the buildings that are not necessarily designated as senior buildings, but where our older population lives.
Okay.
Yeah. Well,
what you've outlined definitely articulates the need for the additional resources that we get from Subaru Share the Love, and the donations we get from them on an annual basis, and show the value of programs like Subaru Share the Love that buttress and support our efforts. What did you learn about your city during this whole thing that surprised you the most, Pat?
Oh, I just could not believe the spontaneous outpouring of help, both volunteers and financial support. It has been truly amazing over the last 7 months, 8 months. The generosity of people in New Rochelle, truly. And their concern for their neighbors who are less fortunate and less mobile. It's been very inspiring. Maybe have a little slightly different view of New Rochelle.
Yeah. Well, you've been inspiring, and I think that you've really given us a good picture of what's been going on during all of these months.
I hope so, because it's quite a program, and if you could hear some of the people that receive the meals thanking us, their gratitude, it's really very gratifying to us as well, and to be part of it and to be instrumental in making it happen.
Well, I'm not showing it right now, but I'm getting kind of emotional right now because I've really been touched. I wasn't expecting this, but I've really been touched by this. What an incredible thing that you and your team have done, that our city has done, and thanks to groups like Subaru, Share the Love, that have helped us in this effort. Just hats off to you, Pat. Cannot thank you enough, and it's just a historic thing that you've done, and I think it would be of worth to kind of just document what was done even more, just for the sake of posterity, and that other communities can learn from what happened here during this time.
I just want to say thank you to Pat Showers, our executive director, for sharing insights into what the situation has been, and tip of the hat and big applause to Subaru Share the Love and how they've supported our organization that was just vital more than ever during this period of time. And just thank you.
Mm-hmm. Thank you.
All right. Thank you very much for your time. Much appreciated. What an inspiring story. Thank you both.